Howdy! My name is Kelly Johnson, and I work with the PEER program at the College of Veterinary Medicine and Biomedical Sciences here at Texas A&M University. And we've put together a series of training videos to help you with your educational endeavors. So today, one of our veterinarian technicians here at the vet school, Dana Whitaker, is going to demonstrate how to apply and remove a modified Robert Jones bandage with her assistant Winn-Dixie.
Okay, so we have Winn-Dixie in right lateral recumbency, and we're going to place a bandage on her left forelimb. The bandage we're placing is a modified Robert Jones bandage, or sometimes called a soft padded bandage. This bandage will always have 3 layers, at least 3 layers. It may have 4 depending on whether there might be a wound or an incision that we need to protect with this bandage. So, you would choose your primary dressing for the wound or the incision. In this case, we're going to pretend like Winn-Dixie has an incision line on her forelimb. This is just a non-adherent pad. The brand we use is Kendall. It doesn't matter which brand you use as long as it doesn't adhere to the wound or the incision. We'll just place that on her limb. I just fold it to whatever size I need. You can cut it, you can tear it, but in this case I just folded it for her. And then when you're placing this bandage, you want to choose the size bandaging material that appropriately fits the patient. Our bandaging material comes in 2-inch and 4-inch. And for Winn-Dixie, I'm going to choose 4-inch material. Put our non-adherent dressing back on Winn-Dixie's arm. Just hold that with your hand there. And when you're placing this bandage, you always want to start at the toes and go up. That helps with a venous blood return so that we won't cause any unnecessary swelling. So always start at the toes and go up. And as I'm rolling this up her limb, I want to do a layer of 50% coverage from one wrap to the next. It's easier if you keep your roll you're working with closer to the limb than pulling it way out and trying to wrap it around the limb. It's more comfortable for Winn-Dixie to not be lifting her arm up and down. When I'm placing this bandage, I want to try to put my cast padding and bandage materials as high up into her armpit, otherwise known as her axillary region. And then I'll start coming back down the limb. Again, I'm going to try to do 50% coverage from one layer of bandaging material to the next. I want to try to keep the cast padding as smooth as possible for Winn-Dixie. Any wrinkles that may be in there could cause her discomfort or even some sores on her limb from the bandage. I'm just going to use this material until I've used it completely. In some private practices, they won't use all the materials. Here at Texas A&M, we will. My next layer is stretch gauze or clean gauze or brown gauze, whatever your clinic may have, and it's a repeat of the first process. It's okay, Winn-Dixie. Wrap around her toes and start going up the limb. Again, 50% coverage from one layer of this material to the next. This material, the stretch gauze, can get too tight, so you want to place it snugly, but not too tight. This is called the secondary layer or the holding layer of the bandage. And again, I'm just going to use this roll completely up. You could cut it if you wanted to at this point. Now is our vet wrap. There's other brands named Coflex and various other items, various other names that you can use, but it's basically just a protective layer for our bandage, sometimes called the tertiary layer. It's obviously the 3rd layer of bandaging material we're placing on the limb. The same principle applies here, about 50% coverage from one wrap to the next, starting at the toes, going up the limb. Again, this material, just like the stretch gauze, can get too tight, so you just want to apply it with some firm pressure but not too tight. time with bandages, if you try to rush through them, that's when you're going to have a problem with tightness or swelling. Again, I'm just going to use all the material on the roll. Just give that a firm press, and we're done. Now she can sit up. And this is a modified Robert Jones, otherwise known as a soft padded bandage. When you send your patient home with a modified Robert Jones bandage or a soft padded bandage, you're going to tell your clients to watch for swelling of the toes. That could be an indication of your bandage having some issues. But as you can see, we can see Dixie's middle two toenails here. If for any reason these toenails spread apart, just tell your client to bring their animal back to see you as soon as possible. Also, if the bandage gets wet, it needs to come back into the clinic so you guys can change that. Also, if there's a wound underneath the bandage and the wound fluids strike through the bandage, that bandage needs to be changed immediately. So those are some things to watch out and to inform your client of. The modified Robert Jones bandage or soft padded bandage could be used on any of the limbs, around the neck, around the chest, or around the abdomen. However, if you're placing the bandage on the chest or the abdomen or the neck, you need to make sure your bandage is not too tight. It could cause the dog to have problems breathing, and we don't want to make our patients cyanotic. When you're removing these bandages, pick a good pair of sharp scissors. I brought two different types. This is the one that I prefer. It has a sharp point and it's got a bill to gather up the bandaging material. These are very sharp, so you have to be very cautious with yourself and your patients. When I'm removing these bandages, I remove them layer by layer. It takes longer, but it ensures that you don't injure your patient. If you have dual bandage scissors, this will take you much longer. So I'm going to take the vet wrap layer off first. We have that layer off. Now I'm going to start to remove the cling gauze layer. And finally, I'm going to start working on the casketing layer. This is where you would have the most injuries if you're not careful because you're against the patient's skin.
Well, we hope you enjoyed that video, and on behalf of the entire PEER team, we wish you the best of luck with your educational endeavors. Don't forget to check out our website at peer.tamu.edu for other training videos and free resources. Thanks again, and we hope to see you soon.